Do your fingers feel stiff in the morning? Do your joints hurt more after rest than after work? Many people think this is just aging or overuse. But what if your own system is quietly attacking your own joints? These symptoms could be early warning signs of an inflammatory joint condition. Hello everyone, welcome back to the channel. I am Dr. Ian Roy, Senior Consultant Rheumatologist practicing at Arthritis and Osteoporosis Clinic in Hyderabad. Today we will discuss the early warning signs of rheumatoid arthritis, signs that are often ignored until permanent joint damage occurs. Recognizing these symptoms early can help you get treatment at the right time and prevent complications. Before we discuss the symptoms of rheumatoid arthritis or RA, in my previous video, I explained what rheumatoid arthritis is and why it occurs. You can watch it through the I button above. Let's understand the early signs and symptoms of rheumatoid arthritis. Rheumatoid arthritis often starts quietly. The symptoms develop gradually over weeks or even months. In the early stage, they may seem mild or occasional, so people don't pay such attention. But over time, the symptoms become more frequent and persistent. One of the most common symptoms is joint pain and joint swelling. Patients often feel it in the fingers, wrists, knees, and ankles. This pain is usually continuous. It tends to be worse in the morning and often becomes more noticeable after periods of rest. For example, after sitting for a long time, the first few movements can be quite painful. In many cases, it affects both sides of the body, which is known as symmetrical, such as both hands or both knees. Even simple activities like holding a pen, cooking, or walking can start to feel difficult. Joint swelling is due to inflammation within the joint. If joint pain and swelling last for several weeks, it is important to consult a doctor. One of the earliest and most important symptoms of rheumatoid arthritis is morning stiffness. You may notice stiff joints when you wake up, difficulty making a fist, stiff fingers, or trouble holding a cup or when brushing your teeth. This morning joint stiffness usually lasts more than 30 to 60 minutes, which is an important warning sign of rheumatoid arthritis. Unlike normal stiffness that improves quickly, rheumatoid arthritis stiffness improves slowly and gradually with movement. Persistent morning stiffness lasting more than 30 minutes should never be ignored, as it can be an early sign of inflammatory arthritis. As inflammation continues inside the joint, it can limit normal movement of the affected joints. You may find it difficult to fully bend or straighten your fingers, wrists, knees, or other joints. This is known as reduced range of motion. Over time, untreated rheumatoid arthritis can lead to chronic stiffness and joint damage, which further restricts your movement. If everyday activities like gripping objects, climbing stairs, or when turning a doorknob becomes difficult, it may be due to ongoing inflammatory joint disease affecting the mobility. Another very common but often overlooked symptom of rheumatoid arthritis is persistent fatigue. Many patients feel unusually tired, even without hard physical activity. This happens because rheumatoid arthritis is a systemic autoimmune disease, meaning it affects the entire body, not just the joints. Apart from joint pain and stiffness, rheumatoid arthritis can also affect other parts of the body because it is an autoimmune inflammatory disease. As a result, some patients may also experience mild low-grade fever, mostly during the evening hours, loss of appetite, unexplained weight loss, general feeling of weakness, dry eyes, or dry mouth. Since rheumatoid arthritis affects the whole body, the presence of systemic symptoms along with joint pain and morning stiffness may indicate rheumatoid arthritis. Early medical evaluation of rheumatoid arthritis symptoms allows timely diagnosis and early treatment, which can significantly reduce the risk of permanent joint damage and long-term complications. If you notice these signs in yourself or your loved ones, don't ignore them. Early recognition can make a major difference in preventing the condition. In our next video, I will explain how rheumatoid arthritis is diagnosed and what treatment options are available. Thank you for watching. Prioritize your joint health, stay alert to rheumatoid arthritis symptoms, and take early medical consultation when needed.